All right, so today we're going deep on something really important in healthcare.
Yeah.
And that's NADH accreditation.
Absolutely.
National Accreditation Board for Hospitals and Healthcare Providers.
Right.
And it's, when you see that, it can be on a hospital or even a blood bank,
Yeah.
it's a sign that, you're in a place that takes quality and safety seriously in India.
Yeah, for sure.
And so we're going to kind of unpack what it all means for these facilities to actually earn that accreditation and, why it should matter to any of us who might, end up as a patient at some point.
Right. Exactly.
So you've got a really fascinating collection of sources here.
Yeah, we've got information right from the NABH website itself.
Perfect.
We've got some insights from a consultancy called Supreme Medic that works in this area. And we've actually got the detailed standards documents that hospitals and even smaller healthcare organizations, have to meet to get this accreditation.
So we're going deep.
Yeah, it's pretty comprehensive.
Yeah.
So the goal is to really cut through all the details and give everyone a clear sense of, what is NABH, why does it matter so much, and what does it actually take to get there?
Yeah. So what is it?
Right to the heart of it.
What is NABH accreditation?
So think of NABH as, an independent body that sets the bar for quality and safety, across healthcare facilities all over India. And when it comes to blood centers specifically, their accreditation really focuses on making sure that every single step in that blood's journey, from the donor all the way to the patient who receives it, meets these really strict standards for quality and safety.
Makes sense.
So that's everything, from the very beginning when the blood is donated, how it's processed, how it's tested, and then, how it's given to the patient at the end.
Right. All those steps.
Yeah, it's the whole chain.
So it's really about building in those layers of assurance at every step of the way to make sure the blood supply is as safe as it can be.
Yeah. And the big picture is that high quality patient care. Right. So, with blood centers specifically, it's all about making sure that safe blood is there when and where it's needed, the right quantity for the right patient.
It's a lot of moving parts to get right.
Yeah, and it requires, that really close attention to detail all along the way.
So I'm assuming for hospitals, though, it must be a much broader scope.
Much broader.
Yeah.
So when NABH accredits a hospital, they're looking at pretty much everything that could possibly impact patient care and safety.
Really?
I mean, it goes beyond just, the actual medical procedures themselves. It's about the whole organization. From their clinical protocols, how they manage medications, infection control, patient rights, even the administrative processes.
So they're looking at everything.
Yeah. How efficient are they?
So I get what NABH is trying to do. But for a hospital or a blood bank, why even go through this?
Yeah, good question.
What are the real benefits to getting accredited?
Well, there are actually quite a few.
Right.
First off, for patients, it's a huge signal of trust.
Right.
When you see that a hospital or a blood bank has this NABH accreditation, they've been through a tough evaluation process and they meet these high standards for quality and safety and when you're facing a health crisis.
Yep, when you need it.
Yeah, exactly. It matters, right? You want that reassurance. And, some studies actually show that patients are starting to look for this kind of quality marker more and more.
Yeah, that makes sense.
When they're choosing their healthcare providers.
Yeah, you want to know that they're committed to doing things the right way.
That's it. Exactly.
Yeah.
And it goes beyond just patient trust, too.
Okay. So
accreditation can also help hospitals build better relationships with insurance providers, because insurers tend to have more confidence in places that have been accredited. So things might run a little more smoothly.
Yeah. Less hassle.
Yeah. Maybe better terms.
Makes sense. And I bet it probably makes things easier with the government regulations too, right?
A lot of times it does because you're already showing that you're going above and beyond to meet a lot of those requirements.
Right. You're already doing it.
Yeah. So it streamlines the process.
But really, I think even bigger than all of that is this idea of creating a culture of quality. Within the whole organization.
Yeah.
It's not just checking boxes on a form.
Right.
It's about making that commitment. To continuously getting better.
Yeah, it's a journey.
All right, so who can actually apply for this NABH accreditation?
Yeah.
And what's the first step they got to take?
Okay, so for blood centers, any blood bank that has a valid operating license can apply.
Right.
And they start by registering online
Okay.
through the NABH website.
Easy enough.
Yeah, pretty straightforward.
And what about hospitals? Is it the same deal?
Yeah, hospitals start with the online application too.
Okay.
But what's interesting is that NABH has this kind of tiered approach.
Oh, okay, what's that?
So hospitals can go for what's called entry-level accreditation first.
Okay. So like a starter accreditation.
Yeah, it's like dipping your toes in,
Yeah.
and it focuses on a core set of quality standards.
Right, so it's not the full...
Right, it's not the full thing.
Yeah.
It's a way to get started,
Yeah.
demonstrate that commitment to better practices without, jumping into the deep end right away.
So it's like getting your foot in the door.
Yeah, exactly.
Yeah.
And then a lot of hospitals will eventually aim for that full NABH accreditation.
Right, once they've got the basics down.
Exactly.
Right.
And that involves a much more, rigorous evaluation.
Makes sense.
So both levels, are about quality,
Right.
but the entry-level option
Yeah.
just makes it a little more accessible.
Right, for hospitals just getting started.
Exactly.
Yeah.
So they can, kind of grow into it.
So let's talk about the process itself for hospitals.
Okay.
We came across this term pre-assessment.
Right.
What's that all about?
So the pre-assessment is super important.
Okay.
It's like a trial run
Okay.
before the real assessment.
Yeah.
So NABH sends out a principal assessor
Okay.
who visits the hospital, and they just get a feel for how well the NABH standards are being put into practice.
Okay.
So they'll look at a ton of documents.
Okay, like what?
The hospital's quality assurance program,
Okay.
their SOPs, standard operating procedures,
Right.
all kinds of policy manuals.
So they really dig in.
They do.
Yeah.
They'll look at how the hospital does its own internal audits, staff training, even just the general cleanliness.
Wow, so it's pretty comprehensive.
Yeah.
Even at this early stage.
Yeah, and they use these forms called PAF.
PAF.
Yeah, it stands for pre-assessment form.
Yeah.
And there are 3 of them, PAF1, PAF2, and PA3.
Okay, what are those for?
So PAF1 is like a giant checklist.
Okay.
The assessor uses it to go through every single requirement of those NABH standards.
Right.
And they just check off, whether the hospital meets it or not and make little notes.
So like an initial gap analysis.
Exactly.
And PF2.
Okay, so that's where the assessor documents any problems they find.
Okay.
Any areas where the hospital isn't compliant.
So the things they need to fix.
Exactly, the deficiencies.
Yeah.
It's really valuable feedback for the hospital because it shows them exactly what to focus on before the final assessment.
And then PAF3.
PAF3 is like the summary.
Okay.
It's the pre-assessment report.
Okay.
So it puts all the findings from PAF1 and PAF2 together.
So the checklist and then the problems they found.
Exactly. And this report also includes the assessor's recommendations for the final assessment.
Okay.
Like how many assessors they'll need, how long it should take.
Right.
And they also give an overall opinion on whether the hospital's ready.
Right.
So it's like an action plan for the hospital, showing them what they got to work on.
What are some of the big things that the inspectors really focus on?
Okay, so a few key areas.
Yeah.
First off, patient safety protocols are huge.
Okay, that makes sense.
So that's things like hand hygiene.
Right, making sure everybody's washing their hands.
Yeah, all the time.
Yeah.
They want to see systems for verifying patient identity to prevent any mix-ups.
Yeah.
And, making sure the hospital has plans in place for emergencies.
Emergencies, yeah.
Yeah, like what if there's a fire?
Right.
What if there's a natural disaster?
Those all seem pretty non-negotiable.
Yeah, they're essential.
Yeah.
Another big thing is documentation and compliance.
Okay.
So inspectors want to see proof that everything is being documented.
So it's not just about doing it, it's about
proving it.
Yeah. Proving that you're doing it.
Yeah.
Right.
And not just, having a bunch of policies written down.
Right. They need to actually be following them.
Yeah, they need to be putting them into practice.
So they want to see that audit trail.
Exactly.
Yeah.
Infection control is another huge focus. They're going to look at the whole environment.
Right.
Is it sterile?
Yeah.
Are the staff following all the infection control protocols?
That's a big deal.
Yeah, it's critical for preventing hospital-acquired infections.
And I would think patient rights are a big focus too.
Oh, yeah, absolutely.
Yeah.
So NABH really emphasizes that making sure patients are fully informed, that they understand their treatment options, that they're giving their consent.
Yeah, informed consent.
Yeah, and that they're involved in those decisions.
So it's about making the patient part of the process.
Yeah, that's it.
And last but not least,
continuous quality improvement.
CQI.
CQI.
Yeah.
It's all about monitoring their own performance.
Right.
Finding any weaknesses and then taking steps to fix them.
Yeah. So it's that constant.
Yeah, it never stops.
Yeah. Drive to get better.
It's about getting better all the time.
So if a hospital is going for that entry-level accreditation,
right,
what are some of the must-haves?
Okay, so for starters, they got to have a documented quality manual and a whole set of SOPs, standard operating procedures, that cover all their departments.
So everyone knows what to do.
Exactly.
Yeah.
Clear guidelines.
And all the staff have to be trained.
Yeah, all staff need training
Okay.
in basic life support like CPR
Makes sense.
and fire safety.
Okay.
They also need a clinical audit calendar.
So they're actively looking at how they can improve.
Yeah, they have a plan for reviewing and improving their clinical practices.
Okay.
Waste management is another big one.
Right.
They have to have logs and a tracking system for biomedical waste disposal.
Right.
And it all has to be done according to those biomedical waste management rules from 2016.
Of course.
Oh, yeah.
Got to follow the rules.
And lastly, they have to have a system for handling patient complaints.
Okay.
So they got to track them, respond to them,
Yeah.
and use that feedback
Right.
to actually make things better.
So they're not just like tossing those complaints in the trash.
No, it's all about learning.
We've talked about CQI a lot.
Yeah.
It seems to be really central to the whole NABH philosophy.
It is.
What does a good CQI program look like?
So CQI is about being systematic,
Okay.
about identifying, monitoring, and improving.
You keep saying improving.
Well, that's the whole point, right? It's
Yeah.
about finding ways to get better all the time.
Yeah.
So you got to track specific indicators,
Okay.
things about the hospital's infrastructure, the processes they use, the outcomes for patients.
Okay.
And it's not just about collecting data for fun.
Right.
It's about using that data.
To actually make changes.
Yeah, to find out what's working and what's not.
So once they've got all this data, what do they do with it?
Well, they analyze it.
Okay.
Look for trends patterns.
No.
Any red flags?
And then
Then they use that information to make improvements to how they deliver care.
So it's like a cycle.
It is a cycle. Measure, assess, improve.
We looked at this one hospital.
Yeah, MMC Hospital.
Malabar Medical College Hospital and Research Center.
Right.
And they seem to have a really detailed CQI program.
They do.
What can we learn from them?
So they do a great job of planning, designing their measurement systems, collecting the data, and then really analyzing it.
Okay.
They track a ton of indicators.
Okay.
So for clinical care, they look at things like
Okay.
how long it takes to do that initial patient assessment,
Okay.
any medication errors, any bad reactions to drugs,
Got it.
any problems with anesthesia, blood transfusions,
Wow.
how complete the medical records are, and then, of course, infection rates.
Yeah.
So it's pretty in-depth.
That's a lot.
Yeah.
That's just the clinical stuff. They're looking at other stuff too, right?
Oh, yeah.
Yeah.
You look at managerial things like how efficient is their drug procurement process?
Okay.
Do they run out of essential medications? How quickly and accurately are they reporting birth deaths?
Mm-hmm.
Any notifiable diseases?
Okay.
Risk management is another area.
Right.
So they're tracking things like patient falls,
Okay.
making sure staff are getting the right preventative measures.
Got it.
And they even look at resource utilization.
Like how many beds are being used.
Yeah, things like bed occupancy rates.
Wow. They're really looking at everything.
They are.
Yeah.
It's a holistic view.
So they're gathering all this data.
Mm-hmm.
What do they do with it all?
So they have specific procedures for how they collect it, store it, and then analyze it.
Right.
And they're looking at, the structure of the hospital, the processes involved in care,
Right.
and the outcomes for patients.
And if they find something that's not working.
Yeah, they're not just going to ignore it.
Yeah. What do they do?
They have a system for corrective action reports.
Okay. So they document the problem.
Yeah, and then they take steps to fix it.
Okay.
And those internal quality audits seem to be really important too.
Okay. So what are those?
So those audits are a regular thing.
Okay.
And they use these checklists
Okay.
that are aligned with the NABH standards.
So it's like they're giving themselves a test.
Yeah, exactly. It's a self-check to make sure they're on track.
Before the real inspectors come.
Right.
All right. Let's shift gears a bit and talk about blood banks.
Mm-hmm.
Is there anything specific to them?
Yeah, there are a few things.
Okay.
So for blood banks, the fees for accreditation actually depend on how much blood they handle.
Oh, that's interesting.
Yeah. So there are different fees
Okay.
for blood banks that process less than 5,000 units a year,
Mm-hmm.
those that handle between 5,001 and 20,000,
Okay.
and those that do more than 20,000.
So the more you handle, the more it costs.
It can make sense.
And these fees cover everything.
the initial application annual fees, even virtual assessment fees.
Okay.
Plus GST, of course.
And what about support for blood banks that are trying to get accredited?
Well, NABH actually offers training programs specifically for blood center accreditation.
Oh, well, that's good.
Yeah, so they have 2-day implementation programs.
Okay.
Sometimes called POI programs.
The Y.
Yeah.
Okay.
And these can be open to everyone.
Oh.
Or they can be tailored for a specific blood bank.
So they've got options.
Yeah.
Okay.
And they also have shorter awareness programs, which are just half a day.
That's great. So if a blood bank wants to learn more,
yeah, if they need help,
they can just go to one of these programs.
Yeah, they've got resources.
What if a blood bank wants to see the actual NABH standards document?
That's easy. They can buy it online.
Okay.
So they just go to the NABH website,
right.
Purchase the document. They mail you a hard copy.
Okay.
It's about 1,000 rupees.
So all the info's right there.
It's all accessible.
One of the sources mentioned this idea of creating an ecosystem for quality.
Yeah.
What does that even mean?
So that's really about the bigger picture. It's
right.
not just about individual hospitals or blood banks getting a certificate.
It's bigger than that.
Yeah. It's about changing the whole healthcare system in India.
Right.
Making quality and safety the norm.
So everybody's doing it.
Yeah.
Yeah.
Sharing knowledge, learning from each other.
Yeah, that's a great idea.
Yeah.
So it's really about raising the bar.
That's it.
For healthcare all over India.
For everyone.
Well, this has been super insightful.
Yeah, it's a fascinating topic.
It's clear that getting this NABH accreditation, it's a big deal.
It is.
For both hospitals and blood banks.
Yeah, it takes a lot of work.
And it's not a one-time thing.
No, it's ongoing. It's a commitment.
Yeah, it's that commitment to quality and safety.
And to constantly improving.
Yeah. And it shows that they're really dedicated to giving their patients the best possible care.
That's the goal.
When you think about all the details involved, all the standards, all the monitoring, it really makes you think about what it means for patients.
Right.
It's a signal that they can trust that facility.
It is.
And it makes you wonder about the impact on the whole healthcare system in India.
Yeah, for sure.
Like, how much does it actually improve patient outcomes?
Right.
And how do you implement these standards across such a diverse country?
It's a huge undertaking.
These are important questions
They are.
that we need to keep exploring.
Absolutely. It's a journey.
It's a journey towards excellence.
That's a great way to put it.
All right. Thanks for joining me on this deep dive.
It's been a pleasure.
We'll see you next time.
See you then.